Welcome to your video on section 18.4, where we're going to discuss leukocytes and platelets. We'll start off describing characteristics of leukocytes. We know that they are going to be in charge of protecting our body against microorganisms and removing dead cells and debris. So they have some special movements. The first movement is an amoeboid movement, where they have pseudopods that can kind of extend on out to reach out to different types of antigens or cells. Another special feature is that they can perform diapedesis. So that means these cells, these white blood cells, are going to become thin and elongated in order to move between endothelial cells. So this here is representing a capillary, and this is really a scene out of how inflammation takes place. So our neutrophil is within the blood here, traveling along, and then when we have inflammation, we get special signals in which we'll have these bars pop up, almost like those little treads that slow cars down, and the neutrophil will have special receptors that'll attach to that, slowing it down and making it kind of roll along the endothelial cells here, and eventually that cell will elongate itself and squeeze in between those endothelial cells. And again, that is called diapedesis. I always say if I create a waist trainer, I'm going to call it diapedesis because it just squeezes right there, creating that thin waistline. And then we have the movement of chemotaxis. And this is going to be positive chemotaxis when we have an attraction to and movement toward foreign materials or damaged cells. And this is the way we're going to get accumulation of dead white cells and bacteria in the form of pus. And I wanted to show you this histology slide of our formed elements. Of course, these red cells here are red blood cells, but look how much larger these white blood cells are. And then our platelets are these smaller cell fragments over here. So our white blood cells are really, truly a cell because they've got a nucleus, they've got organelles, whereas our red blood cells, they don't have a nucleus or organelles, and our platelets are just cell fragments. So that's why we really call them formed elements and not the cells of our blood. And so let's talk about those different classifications of our white blood cells. Remember, we had two classifications, our granulocytes or granular leukocytes and agranulocytes or agranular leukocytes. So we'll start off describing our granular leukocytes, which includes our neutrophil cells. They are going to leave our bone marrow and then stay in circulation for about 10 to 12 hours and then move into the tissues. There they'll become motile, they phagocytize any bacteria they come into contact with, or they look for antigen-antibody complexes, meaning there have been foreign cells that have antigens on them in which antibodies travel and kind of mark them as being foreign, and then the neutrophil will gobble them up. Their job is also going to be to secrete lysozyme, and they will last about 1 to 2 days, and they are going to be the most abundant white blood cell. We have about 60 to 70% of our white blood cells will be neutrophils. Next, we have eosinophils. Eosino, by the way, means red, so their granules stain this red color, and they leave circulation and enter our tissues during inflammatory response. So they are prevalent in allergic reactions. They are going to destroy inflammatory chemicals like histamine and release chemicals that help destroy any of the helminth worm infections. So tapeworms, flukes, pinworms, and hookworms. And we don't have very many of them. About 2 to 4% of all of our white blood cells will be eosinophils. And our last type of granular leukocyte will be a basophil. And you could think baso for blue. So the cell is very blue looking with its granules, large granules. It's going to leave circulation and migrate to the tissues and play a role also in inflammatory response and allergic reactions. Its job is to produce histamine and heparin, and These are the least common in that we have less than 1% of all of our white blood cells as basophils. Now let's move into our agranular leukocytes. We have our lymphocytes that are produced in the red bone marrow, but then migrate over to our lymphatic tissues to proliferate, which is how it got its names as B and T cells. So more on that in our immune system. Their job is to produce antibodies and work extensively within our immune system. And we have about 20 to 25% of all of our white blood cells as leukocytes. Well, we're also going to have our NK cells serve as a lymphocyte. And lastly, we have our monocytes. These are going to remain within circulation for 3 days. And then once they leave the blood circulation, they change their name. They become macrophages. These are going to be phagocytic cells and help break down antigens and present them to our lymphocytes so that they can recognize them, and if they're foreign, kind of launch an immune attack. Our monocytes are going to count for 3 to 8% of all of our white blood cells. There can be disorders of our leukocytes. In someone that has leukopenia, we're going to see that we have too few of these leukocytes, which make it difficult to ward off any disease processes that can take place if this becomes more of a chronic situation. Then we have people that suffer from leukemia. This is a cancer in which we have an abundance of these white blood cells. When this is chronic, we'll see that the mature white blood cells will accumulate and fail to die. And if it is an acute phase, then we have an overproduction of young and mature white blood cells. And then we have lymphoma, which is also a form of cancer. And this is when we have masses of malignant lymphocytes that start to accumulate within the lymph nodes. We'll also see an accumulation within the spleen and the liver and other tissues. This one just happens to be of our lymph nodes within the cervical area. And this leaves people vulnerable to infection. There are lots of different types of lymphomas. Some are really easy to treat and others can be difficult and fatal. Now let's move on to discuss platelets. We've mentioned this before, but our platelets come from the myeloid stem cell, which then develops into a megakaryoblast and into a megakaryocyte. And then those fragments are going to break off and become the platelets. These platelets then are going to play a really important role in preventing blood loss and will create platelet plugs and promote formation and contraction of clots. Let's talk about some disorders of platelets. In thrombocytosis, we are going to have an excess amount of platelets. There are these little purple spots that we see throughout here, and they may trigger formation of unwanted clots, which is known as a thrombosis, which can be fatal if it blocks blood flow in an area. Then we have people that suffer from thrombocytopenia. This is an insufficient number of platelets or a reduction in platelet numbers that is going to have blood that may not clot properly. So we might have excessive bleeding as a result. You may have people develop things like purpura, lots of bruises, and petechiae.